ProtecT trial basically is a prospective randomized clinical trial done here in the UK to evaluate the efficacy of different treatment modalities in low and maybe intermediate risk prostate cancer. It caught a lot of press attention, of lay press attention in this year, and it basically says if you have a low risk prostate cancer, you can easily go with active surveillance. That means you do not have to undergo active treatment. The problem is right at the beginning of such a strategy, you are not really able to tell a patient, do you have a risk of cancer progression or not? And thus the late-breaking abstract that we will hear tomorrow is on the histological features of patients in that ProtecT trial, and they discriminate between patients that have not progressed and patients that have progressed. And then in retrospect, they looked what kind of pathorhistology did these people have in prostate biopsy and if they underwent surgery in the final pathorhistology of the entire prostate. And it came out that the classical classification pattern, it's mostly called after a colleague that's called the D'Amico classification, is not sufficient to tell a patient you will progress or not, but that we need more features like baseline PSA, like how many cores have been involved with cancer, what has been the percentage or the extent of cancer in a specific core, what is basically the tumor volume, and what is the tumor aggressiveness. This is the pathorhistological features that you should know before you advise a patient what kind of strategy could you undergo with your specific prostate cancer in your individual situation. The take-home message of the late-breaking abstract of the ProtecT trial is that the classical clinical classification is not sufficient, that you need more clinical and pathological features to tell an individual if you have a high risk of progression, thus you necessitate very early treatment or not.